Hello everyone in CardioMind's channel, and some of you asked me to speak about the issue of fasting for patients with prosthetic valve. Can those patients fast in Ramadan or not? And just to remind, this is a consensus opinion because we don't have clear guidelines or recommendations. That's why I'm trying to gather here the opinion of most of the cardiologists regarding this issue in this group of patients. We remember from the last video the challenges that a cardiac patient can face when he fasts. The first thing is the hyperviscosity due to dehydration, which can result in thrombosis. Some patients are more liable to hypotension and electrolyte disorders, and some patients may have none or poor compliance to their medical therapy and sometimes unhealthy dietary habits in Ramadan. For the patients with prosthetic valves per se, the main concern when they fast is the hyperviscosity, which can result in thrombosis on the prosthetic valve, increasing the risk of stuck valve. This resulted in a false belief that all patients with mechanical prosthetic valves should not fast. And this is of course completely wrong because not all patients with prosthetic valve are the same. And here I'm speaking about a mechanical prosthetic valve which need long-term oral anticoagulation, not the bioprosthetic valves. So the primary question, which patients with prosthetic valves should not fast, so I should warn them not to fast in Ramadan to prevent them from any complication. First thing, patients who are refractory to oral anticoagulation in whom we need large dose of warfarin and we cannot reach the target INR, those patients are at high risk for thrombosis and embolic complications. Patients with complicated prosthetic valve. For example, a patient who had a thrombus either causing obstruction or not. Of course, this patient should not be exposed to dehydration, or patients who had embolic complication despite adequate oral anticoagulation. Patients who have organic stenosis in the prosthetic valve or having trans or paravalvular regurgitation causing decompensated heart failure. So this patient is in a decompensated state, so at the time being he should not fast till we correct this mechanical complication and the patient becomes compensated. Patients with prosthetic valve endocarditis, as we mentioned, this patient is in acute sepsis. We should boost the immune system, so this patient should receive adequate nutrition and adequate hydration. And patients with mechanical hemolysis causing symptomatic anemia. So in all these cases, there is a complication that need to be treated, and the patient is not fit for fasting at the time being till we treat the complication, and then later on he can fast. And the last issue is the patients with over anticoagulation causing severe or life-threatening bleeding. That in this case, I need to reduce the INR, stop bleeding, and then the patient is allowed to fast after he is stabilized. Not uncommon in our clinical practice to see a patient with labile INR, in which we may increase or decrease the warfarin dose because the INR shoots upwards or downwards. And in this case, we need long-term monitoring till the patient reaches the target INR with a dedicated warfarin dose before he can fast. So based on this information, which patients with prosthetic valves can fast? If a patient having adjusted and stable INR on a warfarin on serial follow-up and he has non-complicated prosthetic valve and the patient is in a compensated state with significant improvement after his valve surgery, so this patient can fast. And in many of these conditions you can see a young patient in your clinic who has stable INR, no complications of the prosthetic valve, compensated state, so please don't prohibit him from fasting forever just because of the concern for the prosthetic valve thrombosis. Don't forget to give him some instruction if he is going to fast. First of all, remind him to the compliance with all the medication, especially warfarin, with adjusted timing of medications in relation to iftar and suhoor, and remind him that warfarin should be taken on an empty stomach half an hour before a meal or 1 hour after it in order to improve its absorption and bioavailability. If the patient is taking loop diuretics and he is in an eovolemic state, it is appropriate to reduce the dose. Remind the patient to drink between 2.5 to 3 liters fluid between the sunset and Fajr. And please remind the patient with the healthy dietary habits in Ramadan regarding quantity and the components. Thank you very much for watching this video, and please share me in the comments with any other disease that you want to discuss regarding the issue of fasting in Ramadan.